Dr. Lee Engel, Upper Cervical Health Centers, Fort Myers. If you're suffering sciatic pain, you know what terrible pain that can be, how debilitating it can be, pain shooting down the leg. Sometimes it's hard to walk, can't sit for very long, stand for very long. Sciatica is generally caused by two things. It's either Piriformis syndrome, which is the large majority of the time, or a disc problem. So let's talk about piriformis first. The piriformis is a hip muscle that runs kind of diagonal down through the hips. And it sits like this, and we have that big sciatic nerve under it, the nerve that runs down the leg. So if that muscle is nice and loose the way it should be, we don't really have any problems. But if something happens and this piriformis gets spastic, it pushes down into the nerve and it shoots that pain down the leg. And what we very often find is a problem in the neck, in fact, is the reason for the issue with the piriformis. The muscles of the hips are controlled by the nerves that come up here out of the neck. So if there's a problem in the neck, it puts pressure on the nerves. Suddenly our hips don't have even tension side to side. They twist a little bit and that piriformis gets tight. So if we correct the neck problem, we can get that piriformis to release. Usually when patients get here, they've tried physical therapy and sometimes even trigger point injections, and they're still suffering with pain no matter how much stretching or therapy is done down there. And it's very often because the underlying cause here at the top of the neck hasn't been corrected. So the other thing, a disc problem. Over time, the disc wears out, it bulges out into the spinal cord or into the spinal nerve, puts pressure on that, and we get that shooting pain down the leg, the sciatica. And very often, if the head is off center, it leans forward, it's rotated a little bit, that puts a lot of pressure on those lumbar discs, and eventually, because they're getting abnormal pressure, they tend to wear out, or there's just too much pressure and it's pushing that disc out of there. And we've had a lot of cases where there was a disc problem, you correct the neck, it sits back up on top, that takes the pressure off the lumbar vertebrae, that bulge comes back in a little bit, takes pressure off the nerve, and we don't suffer with sciatica anymore. So we offer a free consultation. If you're suffering with that, you've tried things, it's just not working, come in, we'll find out if a problem in your neck is causing the sciatica. We'll take specific digital x-rays so we can very precisely find out what that problem is and correct it with no twisting, turning, or popping of your neck, and help you find some relief.